Welcome back with Talk with Terry Tuesday. I am Dr. Toni Scott Terry. So, this is our informative podcast that we do just to give you guys updated information about services and treatments that you may not be aware of. Whether we do it or you go somewhere else, this is just to give you all of the information. Let's get into what our topic of the day is, which is stem cells and stem cell banking. What are stem cells? So stem cells can be anything from your blood, which people call PRP, fat cells, placenta, umbilical cords. There's lots of different things, even bone marrow. There are lots of different things that we use that are stem cells that can be placed in other areas of the body to either heal, repair, rejuvenate the area. What are they doing stem cells for? Everything. And when I say everything, I mean it's everything. Now, it is not, a lot of things are not FDA approved. They are FDA regulated, but maybe not necessarily FDA approved. You can do your own stem cells, which there are companies that actually make stem cells out of umbilical cord, out of placenta. So some of the diseases or treatments or services that you can do with stem cells. Orthopedic surgeons have been using stem cells for a long time. They inject it into joints. So people who are having knee pain, shoulder pain, hip pain, they are injecting stem cells into the joint. And what it does is it rejuvenates the area. So you don't have as much of the pain, the discomfort, the degeneration of the joint and the tissue that surrounds it. It heals the area. So, of course, cosmetics have started to get more into stem cells. So people can use, so I've done liposuction, and people, instead of throwing away the fat, they actually use the fat. Instead of a filler, they actually use their fat cells, which actually last longer. They can last for anywhere from 3 to 5 years, but it rejuvenates the whole area. It's not just filling in a space, but it changes what the skin looks like. It actually helps the collagen. It helps rejuvenate the area that you place it. We've had people take the fat and put it into their breast to actually give them more fullness in the breast. So instead of having, now it doesn't last forever, because it will, just like every other cell, we degenerate over a period of time, but it does last for long periods of time. So where else can you put it? So of course, BBLs, which is the Brazilian butt lift, that is a process of using stem cells. So you're just taking the fat from one area and putting it in another area. You can do it on the hands. You can do it you can do it in the lips. You can do it for hair restoration. So you can do it for a lot of different places, but they're also using it for medical issues. They're using it for leukemia. They're using it for diabetics. There's a trial that's actually going on now for Crohn's disease. So people who have intestinal issues, where they bleed or they have, they can't control like how often they're going to the bathroom. They're using it in a lot of different disease states. I've had a couple of people who I've told about, and they actually are using it in stroke victims because it regenerates those brain cells. Wherever you put the stem cell, it is going to take on that form of the cell and regenerate and heal the area. We have a lot of people who've asked me about stem cells and how does it work and how do you do it. So here's what I tell people. This gets into the stem cell banking. So when we do stem cell banking, what we do is doesn't have to be a lot. We take a amount of generally fat cells, and we actually send it to a stem cell banking company that is able to store your stem cells for technically a lifetime. So whenever you need to actually use some of your stem cells, you just request it and they send you a vial. Now, how does that work? Stem cells can be used by you, your children, your parents. Outside of that, maybe it may be effective. They're doing more research in that, but only one person in the family has to actually bank their stem cells, and then other people can actually use them. Why would you want to bank your stem cells? Because if later on down the line you end up with leukemia, well, that may be something that you can use to actually help you treat leukemia. If you've had a stroke, I've had a patient who actually they're using stem cells to actually treat that person after they've had a stroke. So you've got Crohn's disease, and your child or your parent. We use it for anti-aging. So there's so many different uses, and this is just the beginning of it. Like I said, there are some regulations that go into stem cell and stem cell banking, but there's so many uses for stem cells. I've even seen where they're doing trials for diabetics with stem cells. So it just feels like the use of stem cells is limitless, but it's so useful, especially if you are using your own stem cell or someone in your family stem cell. People are much more comfortable. Well, a lot of people are comfortable using it just because it's you know where it came from. But once again, we do have a lot of other companies that actually have, and these are companies that they are regulated, they are tested, they have third party testing to make sure it is a pure form. There's no additives to it, but it is something that there are some companies that we use that actually come where the stem cells are already prepackaged and you don't have to go through a procedure to actually use them. What people will ask me, well, if I have leukemia, will that be my first option? Probably not. And sometimes it is not covered by insurance. Once again, what I tell people is that it definitely works. It definitely rejuvenates the area, but there can be, there's a cost factor for a lot of people. And that's why I said, if one person does it in your family, then those cells are healthy. They can be stored for almost a lifetime, and other people can actually use those same stem cells. This isn't something that's new. It is something that more people are becoming aware of. These are just tools to kind of help you know what to ask about. Do your own research, of course. But we do cosmetics. We also do some of the joints. I don't do all of them, but it is a rejuvenating factor. And once again, it's not new. PRP is a stem cell. Fat is a stem cell. Been doing it for years, especially orthopedic area. They've been injecting it in joints for a long period of time.
Is stem cell collecting safe?
Yes. It's done under a sterile procedure. We're not just randomly doing it. It has to be something where we actually get you scheduled, set it up. It is a sterile procedure. So no one should be collecting your cells without it actually being a sterile procedure. But yes, it is safe. And if you're collecting it, they're your stem cells. So you can use other stem cells, but if you want to use your own, yes, the collection process for that is very safe and it's pretty quick and it's not painful too, but it's safe, it's sterile, and it's not painful and it's relatively quick.
What types of stem cells can be banked?
So a lot of people are using fat. So usually it's a small technique where I numb the area sometimes around the side or in the belly button. And we actually numb that area and then we actually suction out some of the fat. It is not liposuction. We're not suctioning the whole area. We're just taking a small amount, and then those small amount of stem cells that we send in to the banking location that we use, they actually process the stem cells and they store them. And those are your stem cells. And there is a cost for them to bank it initially. And when they actually send you out a vial or however many vials you need, depending on what you're doing, then they charge you for sending out the vials.
How long is the process to collect the cells?
Maybe about 30 minutes to 40 minutes. I've had families go in on it together. They choose a person and they all chip in on that banking, because then once again, your kids and your parents and your siblings can use the banking. They can use your stem cells. So if you've got 10 people who want to go in on stem cells for a family, you could do that. And then once again, it's not just for, joints and cosmetic. It is for a lot of other medical conditions that you may not foresee. You don't know you might get leukemia. You don't know that you may have a stroke. People aren't expecting those things. But if someone has banked their cells, then you can ask them, can you use them? If they are your sibling, child, or your parents, they can use your stem cells. Maybe some cousins, but once again, not 100% sure. They would check it first to make sure it was a match before they did it. But yes, if you have more questions regarding stem cells, stem cell banking, you can always give us a call. We are at Allure Wellness Center. Allure Laser and Med Spa was our previous name, but we are doing a lot more wellness because we want to take care of the inside, outside, the whole you. So give us a call at 708-864-4988. Be well, be happy, and thank you for joining us.